CEREC Seminars is a little different from other training centers because we provide instruction in the microgroup setting of 6 doctors max. This allows me to address every doctor's individual training needs one-on-one. We implement the tell, show, do teaching model, where I first explain what we're going to do, then I show a sample case, and then you practice what we've just learned hands-on. At the end, we tie it all together in a live demonstration on a real patient. CEREC Seminars is a training center that's immediately adjacent to my own private practice, so we're always able to do live surgery and live demonstrations on real patients. What you usually find in a continuing education course is a lecture setting only in a larger group. What that means is if you don't get a concept or you would like the instructor to elaborate more, you have to interrupt a big group from lecture in order to get your question answered or repeat something that you didn't quite get. Here at CEREC Seminars, in that microgroup setting of 6 students max, we're able to stop at any time. It becomes a very interactive learning experience. Secondly, it's not all lecture and just me talking at you on what great things I've been able to accomplish. It's much more about showing real-life cases with complications so that we can solve them together. It becomes a discussion more than a monologue from the speaker. And I always encourage students to interrupt me as soon as something isn't clear or they want more elaboration. And I find that in the microgroup, doctors are much more comfortable stopping me and saying, "Hey, I didn't get that, can you go over it again?" And when I learn in the small group setting best. And what I also find important when I go to seminars is that I practice things hands-on so that I solidify those newly learned concepts with muscle memory.